Hello, judges. We are Team 1, and this is our diagnosis and treatment plan for Ms. Sobel. So first, in Part 1, we will be describing the symptoms and environmental factors. In Part 2, we will be discussing our diagnosis and a description of the disease, and also how evidence of this disease is presented in the patient. And in Part 3, we will be talking about some methods of testing to confirm the diagnosis and some common treatments.
So firstly, I will go over all the symptoms described or mentioned in the story. There is dizziness, loss of appetite, heaviness, feeling tired, nausea, slurring of speech, throbbing in the calves, throbbing headaches, jaundice, slowed reaction time, slow strength, low stamina, and edema, swelling in the legs and abdomen.
So next is the environmental factors that we want to consider. So generally, when you make a diagnosis, some factors that you want to consider are the demographic information, a surgical history or history of hospital visits, social history, which can include alcohol use, smoking, your occupations, your hobbies, and even your relationships status, as well as a family history, which could tell us more about a genetic predisposition to disease. So from the information contained in the case file, we were able to gather some demographic information of hospital visits, as well as a social history. So Ms. Sobel is a 34-year-old female working as an astronautical engineer. She tends to overwork herself as she worked herself excessively for the 5th time that week. Given the nature of her job and how long she works, she seems to have a sedentary lifestyle. She often turns to smoking and excessive consumption of alcohol to cope with the stress of her life. She enjoys consuming a vast variety of fatty foods, and she also took anti-hangover pills. And these pills often contain an ingredient which causes increased alcohol metabolism, which increases the production of toxic byproducts of alcohol metabolism, and these can damage the liver. She also came to the hospital 2 months ago for a similar issue.
So based on this information, we diagnosed Ms. Sobel with Wilson's disease. First, I will be describing the signs of this disease. So we diagnosed Ms. Sobel with Wilson's disease, which is a genetic disorder which interferes with the removal of excess copper in the body. This causes a buildup of copper in organs such as the liver. Signs of this include fatigue, jaundice, Kaiser-Fleischer rings, edema, speech problems, nausea, loss of balance and coordination, muscle stiffness, a lack of appetite, and abdominal pain. Symptoms of this include feeling extremely tired and weakness in the limbs, feeling like vomiting, seeing yellowness in the whites of the eyes, feeling nauseous and vomiting. The patient experiences weight loss, and they can't speak without slurring. Now I will be describing the affected demographic and the causes of Wilson's disease. So affected demographic includes most people are diagnosed within 5 to 35 years old. They're more common for those with genetic family history of Wilson's disease, and it affects an equal amount of female and male demographic. Patients with diets that involve excessive fat intake and alcoholism are more prone to developing Wilson's disease. Next, causes of this includes genetic disposition to the disease. Alcohol use worsens the copper disposition of this, and malnutrition can cause this as well. Copper can build up because of malnutrition and alcohol abuse.
So we believe Ms. Sobel to have Wilson's disease because the symptoms of this disease become present in individuals due to a buildup of copper in the brain, liver, and or other organs. Thus, whatever buildup occurs, symptoms come with it, which means 2 months earlier, Ms. Sobel also experienced a buildup of copper, causing her to go to the hospital just as she did now. This buildup of copper can occur as a result of multiple factors such as malnutrition and a high absorption of fatty acids. It appears that Sobel tends to regularly enjoy a variety of fatty foods, thus increasing the levels of fatty acids in her body. Alcoholic beverages also contain a significant amount of copper, and it can be interpreted that Sobel drinks a lot of alcohol as her friends have concerns about her excessive drinking. Also, after she drinks alcohol, Sobel experiences symptoms like nausea, fatigue, and a lack of appetite, often attributing it to hangover symptoms. However, these symptoms are common in Wilson's disease, and they appear only after she consumes the alcohol, meaning the alcohol is increasing her copper levels, causing symptoms to be presented. Not only that, but Wilson's disease can cause copper to not properly be released in bile, causing a buildup of copper in the liver, which thus leads to liver disease. This ultimately results in an excess of bilirubin in her body, which is attributed to Sobel's symptoms of yellow-colored eyes and skin. To confirm our diagnosis of Wilson's disease, we would take a liver biopsy, particularly doing a Tim silver stain. This procedure includes taking a sample of tissue from the liver by inserting a needle through the skin. That sample would then be stained under a microscope and would make the copper easily visible. This would then allow us to observe the buildup of copper in the patient's liver. A high level of copper in the biopsy would indicate Wilson's disease. Another procedure would be a urine test. In this test, a urine sample would be taken from Miss Sobel and would be tested in order to determine the levels of copper that are being excreted from the body. A normal range of copper in the urine would be about 10 to 30 micrograms per 24 hours. A patient with Wilson's disease would be observed to have more copper than 30 micrograms in their urine as a result of the buildup of copper in their body. One other procedure to diagnose Wilson's disease is a liver function test, which is a blood test used to diagnose a liver disease or liver damage. This procedure will measure the level of certain enzymes and proteins in the blood. It is used to measure how well the liver is performing its normal functions. One particular enzyme of test is alkaline phosphatase, which is important for breaking down proteins. Abnormal levels of this enzyme can indicate liver damage, such as a blocked bile duct. In Wilson's disease patients, the liver does not release copper into bile as it should, and this is because they have lower than normal levels of alkaline phosphatase. Thus, if these low levels would be found in the test, then it would indicate that the patient has Wilson's disease.
When considering treatment for patients with Wilson's disease, the acronym 3Ds is commonly used. The 3Ds stand for diet, drugs, and displacement, or a liver transplant. The initial treatment method for Wilson's disease is the modification of the patient's diet. It is recommended to avoid foods that are high in copper, such as chocolate, mushrooms, nuts, and shellfish. In addition to considering food intake, one must also consider their water intake. If your tap comes from a well or runs through copper pipes, one should have the levels of copper in their water checked, given the prevalence of copper pipes throughout the world. You may need to use a water filter to remove copper from your tap water. The second D is drugs. Chelating agents such as penicillamine and triatinine are common drugs used to treat Wilson's disease. When treatment begins, doctors gradually increase the dose of chelating agents. People take higher doses of chelating agents until the extra copper in the body has been removed. When Wilson's disease symptoms have improved and tests show that copper is at safe levels, doctors may prescribe lower doses of chelating agents as maintenance treatment. Lifelong maintenance treatment prevents copper from building up again. Another drug commonly used is zinc. Zinc prevents the intestines from absorbing copper. Doctors may prescribe zinc as a maintenance treatment after chelating agents have removed extra copper from the body. Zinc is also prescribed at times to people who may have Wilson's disease but do not yet have symptoms. Lastly, displacement or liver transplants are used. Wilson's disease is effectively cured by orthotopic liver transplantations. This operation involves the substitution of a diseased native liver with a normal liver, or part of one, taken from a deceased or living donor. A liver transplant, however, is extreme and is only necessary in people when cirrhosis leads to liver failure, acute liver failure happens suddenly, or the previous treatments have not been effective. Thank you for your time today, judges. This was a presentation of my Team 1.